Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, I don't think I have been as excited to have a guest on than I have today in a very, very long time, or ever maybe. He's like my own personal hero, Dr. Werlin. Welcome, Dr. Werlin.
Thank you, Elizabeth. It's nice to be with you.
So before we started recording, I was saying that many times people ask me how I got into fertility, and my relationship with Dr. Werlin, whether he was aware of it or not, has gone back to now 30 years almost with my situation with my sister that I talk about often. But then I went back at 30, my own self, to get eggs frozen. And Dr. Werlin said, "Oh, you're too young. Come back later. The technology is not that great." And I remember thinking, oh my gosh, here I am trying to do the good thing after I just got divorced at 30, and was so grateful that you actually were honest with me in saying that at that point, now, how long ago was that? 18 years ago? Yes, that the technology wasn't what it should be for thawing eggs. So then, of course, I came back to Dr. Werlin at 36 and froze some eggs for myself, still single at that point. And then I went to my regular OB for what I thought was something wrong with my period. They told me that I had fibroids, but it wasn't a problem. At this point, I knew that I wanted to be using my uterus. So I went back to Dr. Werlin again and said, "Can you just check this out for me?" And he said, "Actually, where they are, they're small, but where they are is in the lining, so you won't get pregnant." And then he referred me to somebody to get a surgery. And then we were on our way to have our first baby. And Dr. Werlin was along the way for all the subsequent conceptions and losses, unfortunately. But so for me, this is very personal to be talking with you today on the other side of it, because now helping people that are in it, it's again, I realize in hindsight that there was a reason that I was going through all the things in order to tell people that I can understand the angst that they're going through and sitting in those chairs and waiting for the phone calls from the world to see what's happening on the blood work that day or whatnot. So again, just super grateful for you doing what you do and your interjection in our life and our family. So I just want to start with that because many people have heard my story over and over, and you are the person that I refer to in that story many times.
Thank you.
So my first question is a very important question about the Rolling Stones music in your office. For any of you who may have been a patient in the past, or I don't know if you still do because you've moved, but there's Rolling Stones music that plays in the background. And it's such a comforting, fun thing to go in there rather than your typical elevator music. So I'm wondering, is that on purpose or is it just because I know you love the Rolling Stones?
Well, it is my favorite band of all time, and I still listen to the music. If you come into my office now, actually in my actual office,
Yeah.
I play music all the time, and it's usually the Rolling Stones. And in each of my exam rooms, I have an Alexa set up so that she will play Rolling Stones for me. So absolutely, it's still the same. And
Awesome.
actually, you're 100% correct. It is something that I think helps the patients as well. They feel more comfortable in a scenario where they hear music.
Absolutely. And it gets you out of your own head, I think, because it's not really what you expect in a doctor's office, right? But everybody kind of knows the songs, and you have this expectation when you go there, that's what's going to be playing. I remember thinking, okay, we need to turn it down because I need to hear the heartbeat, or I need to focus now once you were in the room. But it really is such a unique experience, but also from the patient perspective, it really does come with a comfort of knowing like, okay, I'm here, in a sense, I'm safe. Everything is still, Dr. Werlin comes in feeling good about things and saying, okay, how are we going to approach whatever's going to come up here today? So I just want to let you know that it does make a difference for us on the other side of the fence.
I'm glad to hear that.
Yeah.
I'm glad.
My other random question is your flip chart that I know that I went through many times with you over the years. Do you know how many times you've said your spiel on fertility and teaching people about
Well,
blastocysts and all the things?
honestly, I think I probably show every single patient that I see one of the two different flip charts that I have, whether it's the one where we show, well, I'll just show you just so you can see it. This is the usual one that
Right?
just shows you how pregnancy occurs, where you have to ovulate, the egg has to get picked up by the tube, sperm have to make it into the uterus, meet the egg in the tube, fertilization occurs, the embryo works its way down the tube over about a 3-day window, floats for a day or two, and then implants. Obviously, sounds very easy, but typically not so easy. And then the other flip chart that I use is the one that looks at
Yes.
your embryos so that you how the normal development occurs. And I absolutely do it with every single patient. So those things haven't changed at all, Elizabeth.
You know it in your sleep, I imagine, all these
I
years,
hope so.
right? Oh my gosh. Well, again, those are some of the things that I think as the patient get implanted because you never really forget those initial consultations of figuring out what is this going to look like for my life. You never really think you're going to be in the office with a fertility doctor and really learning the whole ins and outs of it. And to your point, we think that it's going to be easy, but I remember you saying too, I think the percentage of the chances of it happening naturally is, I don't even remember the percent, but it really is quite a miracle that anybody can get pregnant on their own ever with all the things that have to happen.
That's absolutely correct. And I think what you're doing right now with your podcasts are an incredible benefit to people. The ability to educate somebody and tell them, how you can go about making things happen is a very important thing. Education is the key to people understanding what's going on with respect to their reproductive system. And what you're doing today is really a true benefit for those people out there. So I thank you for that.
Thank you. I really do feel like it's my life's calling that I wasn't even aware of until actually the moment that I knew that this is what I was supposed to be doing was when I had my first DNC with you. And the couple next to us was doing a retrieval. And I remember thinking, oh my gosh, how our world is being ripped from us, literally. And the couple next to us is so excited. And I remember thinking, I'm so genuinely excited for them, but nobody prepares you for this either
Right.
way. Nobody, like, you're not hearing this in your family home growing up. People aren't having regular conversations about either side of the fence. And that's when I said to Dave, I need to help people. And of course, Dave was very affected by all of the situation as well. And he was super supported because he knew he just wanted me to be happy. He just wanted us to have that experience of joy with building our families. And so we're so fortunate now to be able to have that experience to now be able to help others. And I agree, education is so key on this. And luckily, I think it's a whole new world than it was even 12 years ago when I froze my eggs, let alone 7 years ago when I started down this path on having my own babies, which is really cool to see the evolution, which leads me
Yeah.
to my next question. Did you ever think when you went into this a million years ago that it would be what it is today?
Did not, but I have to say that our field, reproductive medicine, is really the most incredibly dynamic field that there is. When you think about the first baby that was born to IVF, Louise Brown was born July 25th, 1978. So she's just 46 years old. Now,
Mhm.
46 years old to most of you out there probably seems old, but in medicine, it's a very
I know.
short time. And in that period of time, they were lucky if the success rate was in single digits. Whereas now, with all of the technology that's involved, we approach success rates in the 60 to 70% range.
It's
It's
amazing.
like night and day, and
Yeah.
so it's changed dramatically just in a very short period of time.
What do you feel from your seat has been the biggest change?
Biggest occurred for our field has been the ability to evaluate embryos before you put them back.
Hmm.
That process, pre-implantation genetic testing, can do at least two different things. The first thing that it can do when you do PGTA, or pre-implantation genetic testing for aneuploidy, allows you to look at chromosome makeup of an embryo so that you know the embryo that you're putting back is chromosomally normal. And then PGTM, which stands for pre-implantation genetic testing for monogenetic diseases, enables you to prevent a hereditary disease from continuing on by diagnosing it in an embryo and therefore not transferring that particular embryo. So it's changed dramatically. I was principal investigator in the first randomized study that was ever done to look at the PGTA, which we did back in 2000. So 24 years ago. We published that data in 2003, 21 years ago. So it's changed dramatically, and it continues to change as we speak.
Yeah, it's so cool. Every day that I'm talking to somebody, I'm like, the fact that we live in a world that this is possible is amazing.
It is. It's really incredible, and it
Yeah.
will only improve.
So, as a med student, how did you think, okay, that sounds interesting to go into reproductive endocrinology? I mean, was it really what even called that then? Not that you're that old, but I mean,
Actually, to be honest with you, that's a good point. So I did my fellowship at the National Institutes of Health, and I was the third national fellow, which meant
wow.
that our field had only been in existence for 2 years before that. So I am one of the old guys in this field. But interestingly, the best part of medicine, I thought, was endocrinology, or hormones, because it's one of the few things in medicine that actually makes sense. You have too much of a hormone, you respond in a certain way. Too little of a hormone, you respond in a different way. And you have an ability to control those. When you look at medical endocrinology, effectively a lot of the things that you deal with are thyroid disease, diabetes, and an older population. But reproductive endocrinology, or reproductive medicine, you deal with basically young, healthy people who you are trying to help to achieve an ultimate goal in their life. And for me, it was the best thing that I think I've ever the luxury of being able to do.
Yeah, what a good gamble.
It really just, it's a wonderful thing.
Yes,
You know yourself just what happens when hormones are raging.
100%. Yeah. I mean, I feel like I remember you saying about the thyroid. I had constantly needing to be tweaked on my thyroid as well during pregnancy, and it would change as I would conceive and get older and whatnot as well. And I think even that alone, most people don't know that it affects the fertility, which still blows my mind that they can essentially go blind in knowing that that's something that needs to be checked when there's across from their OBGYN, and then only to go to a fertility doctor to be like, oh, okay, I just need to get this tweaked a little bit and get everything back online, or my testosterone or whatever it is. And I think that's another interesting concept that I see a lot is when people are talking about going to a fertility doctor or reproductive endocrinologist, they think that means they're going to have to do IVF. And I'm like, no, that doesn't mean you're going to need to do IVF. It means that you're going to talk to a specialist who's going to know everything to check for you. I call it getting the lay of the land. And then you'll know how to proceed from there, right? Because oftentimes, as much as I love the OBs and the gynecologists, they that's not really their area of specialty. But I think that there's this fear for people that if they go into Dr. Werlin's office, that means they're headed down this path. And I just want to say that doesn't necessarily mean that you're headed down the path of IVF.
That's absolutely correct. The main of coming in is to do a good history and physical so that you understand what the underlying problems may be, and if there are any underlying problems,
Right.
and then try and address those as you proceed. And each person is different. And the way that you have to evaluate patients as individuals. We look at the couple as they come in, and we say, typically maybe half of the time it could be whatever the process may be. The reality is never one thing that causes fertility issues unless you don't have sperm, you don't have eggs, you don't have tubes, you don't have uterus, you don't have ovaries. Then it's one thing. Almost always it's a combination of things. And our goal is really to try and ferret out what those problems may be and then hopefully treat them with whatever technology is necessary in that treatment.
Right. Another reference point that's just coming back to my mind as well. I went with a friend who did a donor egg conception with you 18 years ago, which again, then was not super popular. And I went to go see an ultrasound at your office off of Bronca, the old office before. And that was something that was very hush hush then. I think now the world that we live in is so open to that might needing to be an option, which is amazing. And I've seen a lot of my own clients that have gone down that road and have such beautiful experiences. And you would never know that that baby was born, not genetically tied to the mother at all. But have you noticed that as well? The acceptance of being told that to your patients, that might need to be something that they consider, whether it's sperm or egg, that they're a little more open to that now that the conversation is more normalized?
Absolutely. And I think, it brings up a very important point. Of all the things that play a role with respect to fertility issues, the most critical factor is the age of your egg. You're born with all your eggs. So at 35 years old, you have
Mhm.
35-year-old eggs. At 40 years old, you have 40-year-old eggs. Men, on the other hand, the life cycle of sperm is about 74 days with another 20 days or so to get out through the ducts. So every 90 days, sperm change. That goes on all the time. But a 50-year-old man has 3-month-old sperm. A 30-year-old man has 3-month-old sperm. So the critical factor really is the age of the egg. And as you age, that genetic material breaks down. Those eggs become less viable, less
Mhm.
functional, less likely to be successful. So you're right. People are understanding better because of better education and much more willing to accept that they may need to use other options to successfully achieve a pregnancy. And the important thing, you could take the best embryo in the world, but it's the environment that it goes back into that makes this a baby. So when they think about using donor egg, obviously many times the woman is feeling you know sorry that it's not her genetic material, but the reality is that you are the mom. You're the one that gives this baby life. You're the one that's going to sing to it. You're the one that's going to talk to it. You're the one that's going to be able to give it life, and you are the mom. There is no question about it. And
Right.
I think it makes a difference, and people are much more accepting now.
Right.
Absolutely.
And there's so many studies on epigenetics now that people can look into to kind of get that scientific proof to know that that is true
That
in
is
so many sense.
absolutely true, Elizabeth.
Yes. So to that point of having a healthy embryo, I feel like some of the most heartbreaking situations that I have with my clients is when they have the genetically normal embryos implanted and their transfers don't work, which leads me to loss in general for you. How do you prepare for yourself? Because I would often say this, that Werlin has the best job and the worst job, right? Like it's either an amazing day at the office or, oh, that's how do you deal with that to let somebody know that either there's no heartbeat anymore or the transfer didn't stick or whatever it is. How do you yourself mentally prepare and deal with that with your patients?
It is very difficult. That's a point that you make. Part of my interaction with the patient is really to be a part of the of that they take, which is not an easy road. Emotionally, physically, financially, it's a very difficult road to travel. And in order to be able to travel that road with them, you really have to be a part of it. So when they are unsuccessful, it emotionally is very difficult for me as well. And
Mhm.
it's very difficult for me to be the one to have to tell them that as well. But probably one of the most important things that I feel that I tell them when these occur is that they had no control over it, which
Mhm.
is the truth. They've done everything that I've asked them to do to make this come to fruition.
Mhm.
And there are some things that are just out of our control.
Right.
We can't control them.
No.
And I think even though the time they don't believe that when you tell them that, the reality is that that's what the truth is. You follow the protocols, you follow the rules, and you've done everything you can do, and that's the critical thing.
Right. I was thinking last night about this situation and how motivated and how the person who's trying to have a baby is the most motivated patient, in my opinion, right? There's nothing more that you would want in your life than to build your family. And it's this inner feeling that you can't really explain. It's almost like a spiritual experience of trying to connect with the divine in some way, but you can't really put your finger on it. And you are doing everything that your doctor tells you to do because you know how much is at stake, so to speak, right? But you are absolutely right. I could have told you the words that you were going to say because I remember them like yesterday. And of course you feel like it's your fault. Of course you feel like you did something wrong. Clearly you feel like, well, if I was doing everything right or my body was working properly, the baby would have continued to grow. And so it is a really difficult experience to go through from the patient perspective. And, we know that because we've been down that road. And I think equally difficult for you guys, even though it's another day at the office. I think it's not dismissed that it's not difficult for your office as well to know that we weren't successful because at least my experience with Dr. Werlin and his family of team, we really did feel like we were part of the family. You feel like you're there often. Everybody is so amazing. I remember thinking, God, I just want to work here so I can hang out more. Um, and it's really difficult to feel that the family in general has a disappointment. And how do we do from here? And so I think, again, for anybody who's listening, who's had the loss, it's hard to hear that in the moment. But I promise you, in hindsight, you will understand that it really isn't your fault and that everybody understands that you are truly doing what you can do. And eventually it won't be as painful as it seems in that moment.
That's right.
So, have you counted how many births you have had?
Well, it's well over 3,000 babies have been born. And, interestingly, I've also seen um, the children of early pregnancies who've come back and now needed fertility care as well. So second generation babies. It's really
100%.
pretty incredible.
It is incredible. So, again, I'm still in Orange County where Dr. Werlin is, and when you are out and around town and people know what you do, they tell you their story. I did IVF with Dr. Werlin. My kids just got married; their babies are being born now, or I met a nurse practitioner at my GI doctor, and her husband was a product of Dr. Werlin, et cetera. So it really is amazing to see this whole network of Dr. Werlin babies running around the world, specifically more so in Orange County. But it's quite amazing, which leads me to one of my other statements. Does your own personal family recognize what a celebrity you are in your own right in what you've done to make an impact in fertility here?
Oh, well, I mean, for me, I don't this is a celebrity type thing.
Yeah.
This is, I mean, I'm one of the fortunate people who get to do what you love to do. I mean, not everybody goes to work and enjoys what they do.
Right.
For me, this is, a joy to come to work, to see the patients, to help them. I mean, there's
Mhm.
sadness, there's everything.
Of
And
course.
when it's work or there's a loss, it is devastating. But the reality is I love what I do,
Mhm.
and for me, that's the biggest benefit to this. And my family, without a doubt appreciates it as well.
Good. Well, I remember even thinking when I'd pull up at 6:30 in the morning to do my checks and your car's already there, thinking, "Oh my God, his poor wife." Tell her we give a shout out for having the patience of you running off to the office all those mornings to help everybody.
Thank you.
So to that point also with you being on not on but working because the human body doesn't stop for weekends and whatnot, but getting those calls from you, it was always around 10 or 11 in the morning after we did our blood work that morning. And after talking to thousands of people through this the last few years too, those calls that we get from the doctor that day to say what your blood was or the beta test or whatever it was, whether it's an egg retrieval of where things are, is so impactful. And again, I don't know if you realize that, and I'm just saying this in a positive way, that I can tell you pretty much every single time I spoke to you on the phone to get results, whether that was the eggs didn't thaw, I was at the line at the DMV for you to call me and say, I'm really sorry, none of the eggs made the thaw to blastocyst on the, past day 3, or you're pregnant, or you're not pregnant, or whatever it was. And the seeing Dr. Werlin's office come across your phone to hear you on the other line is there's no words really, and that's why I'm pausing because it's so impactful in our lives to know that you are on this journey, and really so grateful for the impact that you have and how you approach your patient care, because I've seen other doctors that they don't approach it that way, giving the empathy or the excitement of the news that you're getting. And it really does make a difference in the game that we're playing in this. So thank you for that too.
I appreciate it. I have always, good news or bad news, I've always been the one to make the call.
Mhm.
You put your faith and confidence in us, and I owe it to you to, one, give you results, tell you what those results mean, and be available to answer the questions that you're going to ask me based
Mhm.
on those results. It's a journey that we both share together. And,
Mhm.
and in order to do that, you have to share that responsibility. And that's really, I've always felt that. And I've always tried to do all my calls, always, good news or bad news.
And I mean, I know again, it's been a while since you've been in med school, but do you feel that they gave you that tool to kind of know what that's going to be like to give the news to people so regularly, and the extremity of it being either really good or probably not really good? Do you feel like you were
Uh,
prepared for that in education?
I'm not sure that.
Mhm.
But I'll tell you, it's interesting. When I was a fourth year medical student, we had 3 mandatory rotations that we had to do. One was surgery, one was medicine, and one was pediatrics. And in all honesty, I thought I was going to be a pediatrician.
Oh,
I
really?
thought I was going to be a pediatrician for all the way through medical school, and so did my medical school. They thought I
Mm.
was too. So my fourth year rotation, I did a rotation on pediatric oncology,
Oh
and
gosh, how
it was so devastating
yeah,
that I just couldn't do it. I
agree.
just, I mean, once I finished with that rotation, I knew I couldn't do that. I couldn't
Mhm.
do that with little kids. But I knew that I wanted to, be a part of helping people make families. And that rotation was so devastating that I really helped me make my choice.
Yes, that's I mean, great comparison to know what you don't want to do, right? And God bless the people that can do that, because
It's
I think that
unbelievable,
is an amazing,
unbelievable, especially
to be
the
able to
young, the,
oh,
the children. I mean,
I
that's
can't even watch the St. Jude commercials without being a
brutal.
mess, with that. Which when I've a few years and usually go to the mindset and all of that, and it has come up recently about doctors not really being prepared coming out of medical school for the emotional experience with how it affects them, and that they're trying to advocate in medical school now so that they are more prepared to be dealing with the conversations that are so difficult to have, because I think it's really underestimated how it can't not affect you in your day-to-day life, because as much as it's science for you guys, if you are, in my opinion, a good doctor that really gets in the pool, so to speak, with the families and the couples, it's impossible not to be affected by it. So hopefully coming up at some point, doctors will be trained as well to help handle those types of things for their own mental well-being, really.
It's interesting. When I actually first started out, a patient of mine was a MF, marriage and family
Therapist.
counselor,
Hmm.
and she was the one who helped me to do that, and also helped me to know when to tell patients, if you need to see a counselor, it's a
Hmm.
good thing. I mean,
Right.
sometimes you can't just share this with your family or just you and your husband.
Right.
Sometimes you need an impartial third party person who can help you deal with some of these things. And we're still very friendly.
Good.
And I ask her for referrals, and she's great. She's a lady.
Amazing. I often quote there's a 2013 Mayo Clinic study that tested fertility client patients, and they felt, or they found, that it was the same stress level as a cancer patient of someone who's going through fertility. And I often say that to my clients, because you kind of think that you shouldn't be as emotional as you are, but like you said earlier, it's your finances, it's your emotions, it's your body going through it. There's so many different elements that you're taking on that, again, most people aren't prepared to do, that it's normal to need help. It's normal to feel like this is such a heavy thing. And I'm such a data driven person that when I found that study, I was like, amen, this is awesome, because we're not all crazy when we're going through it, but you start to feel like you are, because you're so you got to get to the end goal, especially if you're older. I was 40 when I started the journey, so I didn't have time on my side to be messing about. And I think that knowing that there's been studies done to just prove that fact, that it is very stressful. And I think that actually lets people realize, okay, it's okay to get help during this period, and it's not going to be forever.
Absolutely,
But when you get
absolutely
the
right.
help, your success rates are higher too, because you're maintaining your nervous system and all the things that help for success for your body.
That's absolutely right. You hit the nail on the head.
So, what advice would you give to people that are hoping to see a reproductive endocrinologist?
I would always say, well, first of all, we here at RC, um, we are happy to see people. And many times, one of the things that I do every Wednesday is on TikTok, I
Mhm.
do a segment called Wednesdays with the World. And it's about half an hour of discussion and education about a specific topic, and then I follow it up by them asking questions, and I try to answer questions, and I do that once a week, every Wednesday. And for one of those weeks, I just take questions alone.
Mhm.
So I also tell them at the very end that if you follow us, if you see us on TikTok, any one of the four docs that are here with me, Jane Frederick, Lisa Beck, Dan Potter, and myself, if
Mhm.
you tell them that you follow us, your initial consultation is, for free. And
Amazing.
we're happy to see you. It's always of a benefit. And I think, that initial consultation can do a lot for a patient in that it can help give them a picture of what be going on, and also give them a plan of something that they can think through and follow. They don't necessarily have to do it that week or that month or even that year, but
Right.
the reality is that at least they have an idea of how to proceed. So I always think it's a good idea that if you think you're having a problem, then you should look into it. You should just do it. You never want to look back and say, maybe I should have done this sooner.
Right. And it goes back to educating yourself. The
Exactly.
more education you have on your specific body, and that's what I see again quite often, is they'll see something on TikTok or Instagram about Susie Q getting pregnant, and they think, okay, I need to do this protocol because that's what she did. But really, it is so individual, and it really is so important to speak to a doctor and figure out what it is that you need for yourself, because if you're following somebody else's protocol, you don't know if they have thyroid issues, you don't know their family history or whatever else it may be, and you could be wasting time, and unfortunately, time is not on our side in this experience no matter when you start. There's always some sort of timeline that's knocking on your door. So that's great. Wednesdays at what time on TikTok?
Usually it's at 11:45. No, 12:15.
12:15.
12:15,
Okay. Did
and
you
it
ever think you
goes
would
it
be
goes about 1 o'clock.
did you ever think you'd be on TikTok, Dr. Werlin?
No. Oh no. And in fact, it was actually by happenstance. One of my nurses. I mean, you'll probably know this, but when you get the call about being pregnant, it's not just me calling you; it's the whole office
Right.
is in there going, "You are pregnant." And so one of the nurses actually had videotaped it, and
Oh,
I didn't realize that, and then it showed up on TikTok, and it took
viral?
off. Yeah, well, it was crazy. I mean, I
Awesome.
think there must be at one view had maybe almost 10 million people look at it. It was
Amazing.
unbelievable.
That's
And
awesome.
that's how it kind of started. And then we thought we could use this as an educational tool as well.
Yeah, so great. And, that is the way of the world these days to educate the masses. And it's incredible. People ask me again all the time, does it matter that I'm in Saudi Arabia or Mongolia? I have a client. And fertility worldwide is basically the same. So you can log on to these TikToks with Dr. Werlin and get your questions answered, regardless of where in the world you are. Most of the questions are relevant to no matter where you live, what you do, etc., which is the beauty of fertility, I would say. What is the most common question you get on TikTok?
Well, the most common thing that they talk to me about is polycystic ovarian
Mm,
disease.
mhm.
And, the reality is that many people get the label and yet don't get the workup to show whether they have it or they don't have it. If you have the disease, it needs to be treated, whether you're trying to get pregnant or you're not trying to get pregnant.
Right,
If you don't have the disease, you really don't want it because it portends things in the future like diabetes, heart disease, hypertension, things that you really don't want. So if you have it, it needs to be treated. If you don't have it, you don't want it. And that actually is one of the most common things that people talk to me about because it's a term that's used very loosely for
mhm,
many different things. And
right.
yet
And if
it's a
somebody
very
is
specific.
diagnosed with PCOS from a regular endocrinologist, let's say, or maybe their GP, do you feel like they should go see an RE, or do you think no, they can be seen by whoever their doctor is?
If they diagnosis by doing the appropriate testing and do the treatment, they can be seen certainly by an RE. There's no question.
Of course.
But if their OBGYN does the testing and put them on the appropriate therapy, I think that that's fine because as a first step, seeing your OBGYN is a reasonable thing to do.
Right,
But whether or not they're willing to take the time and do the testing and follow up on the treatment, that's another situation. I mean,
right.
they have many other things that they do, whereas this is really what we do.
Again, the specialty. I think that that's so important. We see specialists for everything else in our body. Why wouldn't we do it for our reproductive system when we're told that we have a diagnosis of that nature? Which again, I think a lot of people are speaking to a girl recently. She's I think 36 and was diagnosed with PCOS in her as a teenager and was told then that she wasn't going to have kids. So she's gone all these years just assuming I'm never going to have kids because she was told she's going to have fertility issues. So she was trying to avoid that. And I don't know about you, but I feel like being diagnosed with PCOS by no means you're not going to have a baby.
Absolutely,
So
that's
please
correct.
don't ever think that that is it. It could be a symptom or a side effect of having PCOS, but that doesn't mean you're not going to have children. It just means you may have to have some help in some other ways or be
It's a
medicated.
treatable problem that you can deal with and be
Yes,
successful.
right. And I was heartbroken to know that that's what was said to this girl at a young age, that that was her essentially, and she took that, and her family did as well, to think that that's what it was going to be. Do you see a lot of older patients these days?
So the mean age of patients that I have always seen has been about 38 years old. So I do see an older age group. However, once we started doing Wednesdays with the Whirl, suddenly it changed. I mean, I see women who are in their 20s,
Right.
I see women who are in their early 30s, which is
Hmm.
very unusual. I mean,
Right.
typically I had always seen an older age population,
Hmm.
but it's still, I'd say that I see an older age population. Probably the mean age is about 38, but in fact, I do see younger patients as well now.
Right. That's same with me. When I first started out, I thought, oh, the over 40 is going to be my people because that's where, when I got pregnant and it was all younger
Yeah,
until recently. I've been seeing more people that are older, but I always thought that that was interesting because I didn't expect that, but of course, I always say if you're 25 and want to have a baby or you're 35 or plus, it doesn't matter. That yearning is still there and you should be entitled to treatment or help in whatever age you are, despite you being too young, so to speak.
absolutely.
What do you think that will you would have told your younger self? Any advice that you wish you would have told your younger self in looking back?
Well, I mean, as weird as it is, I've always wanted to be a doctor from the time I was. I mean, yeah, I wanted to be a cowboy, I wanted to be a fireman, I wanted to be those things too.
Right.
But ultimately, for my whole life, I really wanted to be a doctor. And I was in the group of physicians who, where when we got to medical school, the only deferment for the Vietnam War was medical school. It used to
Mm-hmm.
be any kind of graduate school was a deferment, and then as the war, and they had the first lottery, which was 1968. It became medical school was the only deferment. So in my people who are doctors, there were people who really didn't want to be doctors, but
Mm,
went to medical school so that they didn't have to go to Vietnam.
right.
And it made a difference in the group of physicians who are my age and how they to people. And it was, it's an unfortunate thing. I, for myself, always want to be a doctor. I loved being a doctor. I love being a doctor. I love seeing the patients. I love interacting with them. And so for me, watching some of these other people who just did it so they didn't have to go to Vietnam
Hmm.
was not a good.
Right.
And many of those people are not in medicine anymore, just because it really wasn't what they wanted to do.
Right. I mean, I do feel at some point it catches up to you if it's not really what your
Absolutely.
heart needs to be doing. Well, any final words of wisdom for us, Dr. Werlin?
Well, the reality is that if you think you have a problem, then you should address it. You should never look back and feel that you didn't do everything that you could do. There isn't an answer to the question, but the critical thing is to do everything that you can do to try and do what you need for yourself. And my favorite song of all by the Rolling Stones is You Can't Always Get What You Want, but if you try sometimes, you just might find that you get what you need. And I live by
Amen.
that. I live by that because you don't always get what you want, but you do the work and you get what you need. So
Right.
I appreciate your taking the time, Elizabeth. It's wonderful to see you, and thank you for doing what you do in helping these people along the way.
Well,
They
thank
people
you because
need
I wouldn't be
people.
here if it wasn't for you and everything that you've done and showed up in our life for to get me interested in caring about it as I am now. I mean, I tell people they like to geek out on sperm and egg health and whatnot. And, and it's true. Like you said, you always wanted to be a doctor. It's what I live and what I'm passionate about and what I really do feel that if I would have gotten pregnant so easily without having to see you, I wouldn't have known that this is what I needed for my life in order to pay it forward to help other people on their path. So,
That's the key.
yeah. So I'm
You
super
get what you
grateful.
need,
Yeah.
and I think that's great.
All right. Well, have a good rest of your day. Thank you so much. If anybody needs and wants to talk to Dr. Werlin, he's at HRC Fertility in Newport Beach and on TikTok on Wednesdays at 12:15. Thank you so much for your
Thank
time.
you,
Again,
Elizabeth.
so grateful. And hopefully we'll get to stop in person soon and give you a hug.
We'd love to see you.
Keep
Thank
doing
you.
what you're doing. Talk to you soon.
Thank you.
Thanks.
Bye-bye.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.